Now we want to answer this question: what type of blinding was used, and was this type appropriate or not? When you conduct any clinical trial, these are the persons that are involved in the trial, along with the patients, the principal investigators, the treating physician, evaluating physician, study coordinators, independent DSMB, data safety monitoring board, and so on. A lot of people are in the trial. And these people, because of course they are humans, they may introduce bias. For example, the principal investigator might want the study to work, might want the treatment to work, so he might introduce the bias. Or maybe one of the people are in the trial, they don't want the study to work, so they might put something that to underestimate the effect of the trial. So, for example, if you are doing a study for an experimental versus control, a placebo, for example, if a patient knows that he is receiving the placebo, he wouldn't want to complete the study because he knows that he's taking the placebo. There is no benefit of completing this study because I'm taking the placebo. Also, if the evaluating physician knows that this is the drug, he might report the adverse event more. And lastly, the data manager or the biostatistician, he might change the way he will do the statistical analysis if he knows what is the treatment and what is the control. So what is blinding? Blinding is a technique in which the subject and or the investigator are unaware of who is in the intervention group and who is in the control group. Blinding techniques are incorporated to reduce any possible bias. So now we will talk about types of blinding, assessment of blinding, who should be blinded and who cannot be blinded, or who can be unblinded, and a conclusion. So the first type is an open label. Open label means, and we have taken this in the peer review as well, that open label, both the investigator and the subjects are aware of the assignment. Nobody is blinded at all. And I need you to think, in which study it's ethical, or there is no bias of making an open label study. Okay. Second one is a single blinded. The single blinded, the investigator are aware of the assignment, but the patient doesn't know. So the patient doesn't know whether they are taking the placebo or any control, or they are taking the intervention, and the investigator are the only people who knows about it. Single blind and no blind are preliminary incorporated that in clinical trial that have study objectives not conducible to blinding. What I mean here, if you are doing two different surgical procedures, so the patient should know that he is doing a surgical procedure. If it is, for example, surgery versus medication, the intervention group is taking the surgery, the control group is taking the medication. So for sure, people will know that they are doing surgery and these are not doing surgery. So they will know, and you cannot do double blind here. So sometimes it's difficult to blinding, like in surgeries. That's why it's a single blind only, or maybe it's an open label study. There is another method which is single blind with third rater, and this is we usually do it with when we want to assess the adverse drug reaction. So, and we cannot make the physician blinded, the treating physician blinding, because maybe it's a critical disease that the treating physician need to know what type of medication the patient is taking, but we will not make him evaluate the result, evaluate the adverse event, because he knows that this patient is taking this medication and the other patient is taking the other medication. That's why this is what when we do the single blind with third rater. The double blind is another method in which the investigator and the patient, both of them, they don't know, and this is the gold standard technique in most of the randomized clinical trial. And this is this considered to be the ideal setting, which minimize or eliminate bias. In the informed consent form, the patient are signed on. It states in any blinding that the patient has a certain probability of being randomized to one of X treatment. So it will say if they are through treatment, you have 50% chance to be in the treatment group and you have 50% chance to be in the control group, for example. And sometimes the treatment by an individual patient can be deduced. What I mean here, just imagine if the patient is taking ACE inhibitor. If he got dry cough and the other patient is taking diuretics, he will know that he is the one, or the patient or the physician will know that this patient is on the ACE inhibitor because it's obvious that he has one of the obvious side effects of the treatment. In order to ensure that the blinding remain intact, the therapy of each group should be exact in frequency of administration, appearance, size, taste, and smell, and other variables. And this is what we call the double dummy. If I have different dosage form, for example, a tablet and capsule, like in this study, they wanted to compare between the amlodipine and the benazepril. So one was tablet and one was capsule. So here, what they will do, the first group will take the tablet plus the placebo capsule, and the other group will take the capsule plus the placebo tablet. Finally, the triple blind, here, the added person who is blinded is the data manager, the one who is doing the analysis of the study. He as well should be unaware of which is drug A and which is drug B, so that to make a fair statistical test. This is the blinding. So how we assess the blinding? There are different methods assessing the blinding, and this is a famous study by Kohali et al., which is by surveys. Ask subject to guess, subjects are the participant or the patient, ask subject to guess the treatment assignment at the end of the treatment, and maybe another method is to ask subject change in belief of treatment assignment from the beginning to the end, or assess subject belief of treatment assignment at several time points through the study. And we use the third one if we have a large follow-up period. So it's either ask them at the end of the study, what do you think you were taking, the treatment or the intervention? Or assess the difference at the beginning, what do you think, and then at the end, what do you think, or at several times within the study. Okay, who can be unblinded? The manufacturer definitely should be unblind because he's the one who's manufactured the drug. The pharmacists play an important role in clinical trial. He is the one who gives the drugs, and he will be unblinded. Some other, like medical monitor, or what we call them, the data safety monitoring board. And these data safety monitoring board contain of one physician, maybe one statistician. They review, while the trial is going, the individual and the aggregate safety data, and sometimes the efficacy data. For example, if they find that the drug is overwhelmingly effective, that means why to complete the study for 5 years while we already know from the first year that it's so effective. Also, maybe for the safety, if we find serious side effects after 1 year of the study or after 3 months of the study, so we cannot complete, it will be now unethical to complete the study because of the safety issue. And this is the rule of the data safety monitoring board. That's it for blinding.